AAPLOG is the largest group of Hippocratic medical physicians specifically dedicated to address the life issues in obstetrics and gynecology. We believe that killing another human being, our second patient, the preborn child, is not a therapeutic option. AAPLOG doctors try to optimize the best care for both the pregnant mother, our patient, and her preborn child, who is also our patient. We look at the medical literature and try to provide that information to our members so that they can defend both their pregnant female patient and her preborn child.
Many physicians today, especially physicians in training, are facing pressures to not only discuss abortion as an option with their patient, but even to recommend it or to participate in abortions. And this is simply not okay. This is never how medicine was meant to be. And yet it has found its way into the practice of so many. It's found its way into medical training programs. And people who are coming through medical training programs now are being told that in order to be a good physician, in order to be an OBGYN who truly cares about her patient, you have to either provide or refer for abortion.
Being in the academic sphere sometimes has presented barriers to being able to freely speak about and practice in a pro-life manner. At one of my career positions, I was asked to be careful what I said because there was certainly bias about any sort of pro-life stance or pro-life beliefs. We are called to beneficence, which is always doing the right thing for patients, the good thing for patients. That sometimes will clash with patient autonomy when patients are wanting you to end a life.
AAPLOG has been involved in giving the pro-life, pro-Hippocratic medicine position in every Supreme Court case on abortion because part of our mission is to speak the truth in the public policy arena and to let people know that Hippocratic physicians defend both the pregnant woman patient and her unborn child.
And yet the truth of this is really not discussed outside of venues that AAPLOG is helping empower. The truth of the harm of abortion on women and the truth that this is a living human being that's growing inside of her and as such deserves the same protection as any of our other patients do.
I think that mentoring young physicians is incredibly important. The words used to discuss that with these medical students and residents, as well as the compassion both for beginning of life and end of life, is very important in forming these young professionals' future career.
The biggest surprise is how many physicians actually don't think abortion is a good therapeutic option. 85% of OBGYNs do not do abortion in their private practice, and they certainly could. It's well within their training. But the reason we don't do that is because we see that killing human beings, it hurts the mother long-term and it ends the life of her child. And we didn't go into medicine to end human life. We went into medicine to care for human beings.
If I'm discussing life and personhood with another physician who feels like abortion or being pro-choice is what should happen or what needs to happen, I encourage them to consider what it means to be a physician. At the core of that is caring for people and caring for persons. If we deny personhood to any human, then we are causing damage to the profession of medicine.
I think if you ask anyone who went into the field of OBGYN, most of us would say that the reason that we were attracted to this field is because we really enjoy helping to bring babies into this world, that the practice of abortion is really antithetical to the practice of OBGYN. We didn't go into this field to destroy life. We went into this field to help bring life into this world.